Welcome to Dr. Avinash Phadke Lab videos. I'm Dr. Alvin Alva, and today we're going to learn about the symptoms of diabetes. The symptoms in type 1 diabetes as well as type 2 diabetes are similar because both of them result in high blood sugar levels. Let's take a look at these symptoms. Diabetics usually complain of increased frequency of passing urine. The medical term for this condition is polyuria. This happens because increased blood sugar levels lead to increase in sugar in the urine. Increased sugar in the urine pulls water along with it to increase the volume or amount of urine. Because of this increased volume, diabetics feel the need of using the washroom more often. Because of increased loss of water from the body through the urine, dehydration occurs. This results in another symptom of diabetes, which is increased thirst, also known as polydipsia. Diabetics also complain of polyphagia, which means increased hunger. This happens because of the following reason. Insulin is essential for glucose to enter the tissues to be used as a source of energy. Because of less insulin or lack of insulin action in diabetics, the sugar present in the blood cannot enter the tissues to be used as energy. Therefore, in spite of having high blood sugar levels, the body feels that there isn't enough sugar available. The body then signals the person to eat more. Unfortunately, eating more food does not reduce the hunger, but only adds to the already high blood sugar levels. Less glucose within the tissue also leads to increased fatigue or feeling tired most of the time. In type 1 diabetics, there is weight loss despite an increase in the appetite. This happens initially due to loss of body water through the urine and because of dehydration. Later on, due to breakdown of fats and proteins, there is weight loss. This symptom is not usually seen in type 2 diabetics as it is usually associated with overweight individuals. In such overweight people, the slight weight loss due to loss of water and loss of muscle mass may not be visible. Many patients of diabetes do not have any symptoms at all or may ignore the symptoms of increased thirst, hunger and urination. As a result, they may be diagnosed as diabetics only when complications occur and blood investigations are done for diagnosis. For this reason, it's recommended to get your blood sugar checked at least once a year, especially if you have risk factors like being over 40 years of age, being overweight, having very little physical activity, having a high blood pressure, and a family history of diabetes. Some diabetics may present directly with symptoms of complications of diabetes without having any previous symptoms. Complications may include slow healing wounds, tingling and numbness of hands and feet, skin infections, blurred vision, urinary tract infections, swelling over the face and the body due to kidney disease. Those who are already diagnosed as diabetics and are currently on medication may have symptoms of low blood sugar levels. These symptoms include excessive sweating, lightheadedness, giddiness, and trembling of hands. If you are a diabetic, please maintain your blood sugar levels at the optimal level even if you don't have symptoms, because several people who neglect their blood sugar levels only based on whether they experience symptoms end up suffering from disastrous complications after several years. Try keeping your fasting blood sugar level above 70 mg% to avoid symptoms of low blood sugar, and depending on your doctor's advice, try to keep your average blood sugar levels between 120 to 160 mg%. To summarize, the different symptoms of diabetes are increased urination, increased thirst, increased hunger, fatigue, weight loss in type 1 diabetics, and symptoms of complications like slow healing wounds, tingling of hands and feet, skin infections, blurred vision, and swelling all over the body. In the next video, we'll talk about the different complications of diabetes and the reasons behind them. If you like this video, don't forget to hit the subscribe button and leave a comment in the comment section. Thank you for watching and see you soon in the next video.